intergenerational mobility. Okay. So a lot of you may have seen this picture before. This is some work by Chetty and his co-authors that uncovered a lot of heterogeneity in economic mobility in the United States. So basically, they're finding that some children face ample economic opportunity while others experience relatively little. In our project, we want to think about what this picture would look like for education mobility or health mobility or other kinds of traits between parents and children. We want to think about whether observed intergenerational mobility in one trait, like income or health, is representative of the individuals or places mobility in other traits. So if we identify groups of people or places that have high economic opportunity, like the lightly colored commuting zones in the map here, are kids in these places equally more likely to break the intergenerational cycle of poor health, welfare, or smoking, or some other trait? We think of mobility in different domains: resources, health, or other. Previous literature has examined many of these domains individually, but very few have looked at cross-domain relationships. The closest example might be Halliday, Mazumdar, and Wong's 2018 working paper, where they think about whether people who have a lot of intergenerational health mobility also have a lot of income mobility. In our paper, we want to look at many different types or domains of intergenerational mobility. And this is going to help us understand whether education mobility is the same thing as income mobility, or if health mobility is the same thing as mobility in health behaviors. We really don't have a strong prior for whether mobility domains should or should not be related. In some cases, there are models that would suggest a link, like the Mincer equation, where earnings are a function of education. We also know that there is a causal link between income and health or cognition, particularly later in life. But shocks to certain traits can arrive exogenously to either generation, and the shocks may or may not be related. We currently study the 11 domains of intergenerational mobility listed here. With data limitations, some of the domains are available only as binary variables, but around half are semi-continuous. With these, we're going to rank individuals within their generation, which follows the economic and health mobility literature. In all domains, we're thinking about mobility primarily in terms of the persistence of traits across generations. So high obesity mobility, if you will, is really a low persistence of this trait between parents and children. Religion is an outlier. In contrast to other domains, there's not an obvious preference ordering. We've coded it as higher values represent more spirituality, but we want to be clear that unlike resources, health, or incarceration, where higher values always represent a preferable outcome, there's really no such ordering for religion. Both unhealthy and healthy parents alike wish their children to be healthy, but the same cannot be said for spirituality. So to answer our questions, we're going to be using the National Longitudinal Study of Adolescent to Adult Health, or AdHealth. We're using the first wave for parents and predominantly the fourth wave of data for children. We do also look at the fifth wave when kids are quite close in age to their parents at wave 1, but we do have quite a bit of attrition between wave 4 and wave 5. AdHealth is nationally representative of children who were in 7th to 12th grades in the 1994 to 1995 school year, and sampling occurred at the school level. So we have more than 10,000 parent-child pairs clustered in around 130 schools. For the individual level analysis, we're going to be using all available parent-child pairs and incorporate AdHealth's complex survey design and weights to account for sampling design. For the place level analysis, we will focus on wave 1 AdHealth school clusters. Unfortunately, we can't observe precisely where these schools are located in the US, but they are spread out across the country. So we see the school as a geographic cluster of parent-child pairs that characterizes the intergenerational mobility at that place. Within the school cluster, there is a random sample of students called the core sample. Additional kids are part of oversampling certain traits within the school to help with national representativeness, The place results I'm going to show you today, though, rely on the school's random sample only, although results are generally robust to using the larger sample as well. There's a wide range for the number of kids per school, but we're going to focus on schools with at least 20 sample kids. Although we don't know where the schools are, we do know the census characteristics of the place. So we're also going to look at whether there are any local characteristics that may make places more or less mobile. Our first task is to think about whether individuals who experience mobility in one domain also experience mobility in other domains. Essentially, we're first asking, how different are you from your parents? And if you're very different in terms of income, are you also very different in terms of education, health, the propensity to smoke, or to be on public assistance? We're going to follow the conceptualization of individual mobility from Halliday, Mazumdar, and Wong's 2018 working paper, which defines individual mobility as the difference between parent and child traits. When this mobility measure is positive, children are better off than their parents were. In the case of continuous traits like income or health, this mobility value can range between -100 and 100 percentiles. In the case of binary traits like smoking or obesity, it just ranges from -1 to 1. After we know each individual's mobility experience, we then look across domains to see if someone who is a lot healthier than their parents is also more educated or also has a higher income or is less likely to smoke or be obese, etc. We'll first compare average mobility for all domains by income mobility deciles. Next, we're going to look at a correlation matrix of individual mobility across domains. The second task is to think about whether places that are mobile in one domain are equally mobile in other domains. We calculate mobility in each geographic cluster by running an intergenerational mobility regression for each school. Parent traits are regressed on the child's trait controlling only for age, and beta 1 in the equation here is the coefficient of interest. It measures the persistence of traits across generations, with values near 1 indicating children are typically very similar to their parents, i.e. there's low mobility, whereas values near 0 indicate little patterning of traits across generations, or that there's high mobility. We'll start with examining the correlation matrix for place mobility across domains. This gets at whether places with high income mobility, for example, typically also have a lot of health mobility. We're next going to consider whether there are any characteristics of the local area that consistently describe high or low mobility places, but across all domains. So this first figure calculates average education, public assistance, health, or obesity mobility for individuals based on their observed income mobility decile. So kids who have far lower income than their parents are in the bottom decile of income mobility on the left of each panel. Kids who have a lot higher income than their parents, the rags to riches type story, are on the far right of each panel. Looking at the top left, we see a pretty clear positive gradient. Kids who have a lot higher income than their parents are also completing more education than their parents. Directly below, there's some evidence that they might also have better health than their parents. In the top right, there's a pretty small but positive gradient for public assistance, but we don't see a very clear visual pattern with obesity. Looking at this another way, we can see the correlation of individual mobility experiences across all of our domains. The two highest correlations we see are between income and earnings, and binge drinking and alcoholism mobility. The high correlation between income and earnings mobility is an outlier at over 70%, but this isn't too surprising. I'd like to focus, though, more on the relationship across the other domains. Generally speaking, we see a lot of yellow coloring, a little bit of orange here and there, but mostly just a lot of yellow. If you look at the scale, this means that we're really not seeing a whole lot of correlation between the different types of mobility at the individual level. Just to briefly root ourselves in what the correlation of these traits looks like within a single generation, this is the correlation of these traits among the parent generation only. So we can see a lot more red coloring in this matrix, relative to the intergenerational matrix here. So flipping back to our intergenerational matrix, we see that the clear positive gradient that we saw from the previous results slide in education mobility by income mobility decile corresponds to around a 20% correlation. The relationship between income and health mobility is around 12%, although this does increase to 17% in our data with Wave 5 data. We do see a relatively higher correlation between obesity and health mobility, or smoking and education mobility, but these are still only around 17%. In this picture, parents are typically around 42 years old, while their kids are around 29 years old. But these patterns are pretty robust to using Wave 5 data when kids are around 38 years old too. So this means that kids who are a lot different than their parents in one trait might be a little more likely to be different in some other traits, but by and large, the kids who are experiencing income mobility, for example, are not necessarily the ones experiencing health mobility. We really don't see much relationship even within health and health behaviors. So kids who have a healthier weight than their parents are not at all less likely to smoke or drink than their parents were. Flipping over to the correlation of mobility across places, we see a pretty similar pattern. If anything, we're seeing a little more green in this picture, indicating correlations in the negative 10 to 15% range. So this would be places where kids have a lot more economic opportunity, might also be the places where health behavior patterns might be more persistent. Recall, though, that persistence measures are silent on whether the traits that are passed on are good or bad. So perhaps the places with high economic opportunity are places where parents consistently pass on good health behaviors. With few exceptions, correlations of place-based mobility appear small, ranging from negative 15% to positive 15%. So if we think about Chetty et al.'s economic opportunity map from the first slide, the places that have a lot of economic opportunity might not be the same places that have a lot of health mobility, or where kids have less persistence in incarceration. Next, we want to touch on understanding characteristics of places that might be related to either high or low mobility. A few papers find that the South in particular seems to have a little bit more persistence in terms of income, education, or health across generations. Our data suggests that there is statistically higher persistence in income or earnings, but there isn't statistically higher persistence in any other domain in the South. Although we don't have time to really delve into other place characteristics today, we don't really see any consistent local characteristics associated with high or low mobility across all of the domains. So that is to say that an area's socioeconomic status or demographic composition, the number of hospital beds, et cetera, might be associated with mobility in a single domain, but that association does not extend to all of the domains we've studied here. We are finding that intergenerational mobility is probably not generalized. That means that people in places that are highly mobile in one domain may or may not be highly mobile in other domains. This is consistent with initial analyses by Halliday, Mazumdar, and Wong, who found that the correlation of individual income and health mobility was around the 20 to 25% range. We have a number of limitations and challenges in our study. We are thinking a lot about attenuation and life cycle biases. All of the results I've shown you here today rely on a single measure of each trait per generation. We know from existing literature that this attenuates mobility or persistence measures, but that multi-wave averages could reduce this bias. So we have looked at results that average the child's traits from waves 4 and 5. We do see some higher persistence estimates as expected, and some slightly higher correlation measures across domains, but the results are pretty robust. Another source of bias we think about is life cycle bias. We observe the child's traits when they are adults, but they are quite a bit younger than their parents. So in wave 4, children appear a little healthier and with lower income or earnings relative to their wave 5 observations. However, we also have attrition when moving from wave 4 to wave 5. Results are mostly robust to using later child data. I think the most noticeable change is that the correlation between health and income mobility is a little higher. And I think that that would be consistent with the child's latent health perhaps being more revealed at the later time. We also want to think, though, about the why aspect. Like I said previously, we really don't have a strong prior on whether mobility domains should or should not be related. On the one hand, there are models like the Mincer equation that explicitly link education and earnings, but shocks can also arrive exogenously. Another aspect to think about is whether the genetic propensity to pass on traits differs across these domains. Preliminary results here are suggesting that there are likely differences, but a fuller investigation is warranted. So thanks so much for listening. I'm looking forward to your comments and suggestions to help us move this project forward.
So Katie, you're doing this in preparation for like a 15-minute self-contained talk, yes, which is what you just tried. So maybe maybe especially questions on, I didn't pick up on X in slide 3 or something would be helpful, because you're going to be like, your deliverable is going to be this 15 uninterrupted minutes for a conference.
For that. I forgot to mention that at the beginning. This is for a conference workshop next week, Monday, and it's a very clear, like, you have 15 minutes to get your point across, and that's pretty much it. So anything that you think that I could clarify would be particularly helpful.
So Katie, are you looking for comments on what you've done, or more about sort of future points? Because it looked like your questions at the end were more focused on like where to go. And I think some of this work is already published, right? So
no, none of this is published. Okay. Yeah. So to answer your question, both, like the short-term questions would be, you know, is this clear in this like very condensed 15-minute period? Because I feel like we're trying to cram a lot into this 15-minute period with looking at like the individual based question as well as the place-based question. So I want to make sure that those are kind of like clearly mapped out, but also thinking about like the next steps and everything like that, and moving this more towards getting ready for publication too.
I guess I would just say I generally agree. I think you probably are not surprised, because we've had this conversation a little bit before, that, you know, intergenerational mobility doesn't generalize well from economics to health outcomes. So, you know, I think it's nice to now see that sort of robustly laid out, you know, not just based on intuition, but based on a whole bunch of analyses, careful analyses that you've all done there. And so what do you, I guess the question is sort of what kinds of next steps are you thinking about given that?
Yeah. So I guess for me, a continuing question and lingering question that I have is more about the attenuation bias, right? I think it would be a lot easier if we could say that it would operate very similarly in all of our different domains. But I wonder the degree to which that is in fact true, just because the measures that we're using in different domains are quite different, right? We're using self-reported health for our overall health status, which is a 5-point Likert scale, which we transform into kind of, you know, a 0 to 100 type scale that adjusts for kind of the marginal distribution type concerns. But the fact remains that there's only 5 possible categories in the semi-continuous measure. And if we're comparing that with income, where I think wave 1 has 10 income bins, and then the kids' data might be more continuous in nature. But the fact that we have more possible outcomes, I guess, in these 2 different domains, does that mean that more noise is introduced into the health measure versus the income measure, in which case then attenuation would operate differently across these 2 domains?
So this is not to preclude the idea that health itself is just a noisier measure, but then in addition to that, also how we're measuring it is adding, right? So it's both on its own actually noisier and harder to measure, right?
Yeah,
because
I wasn't even thinking about the fact that it is in and of itself a noisier measure, but also, yes.
Right. So like, I think this conversation is all proceeding as if like there is some gold standard way to measure health and we're just not using it. But in reality, health is not one thing like income, right? Health is many, many things that are actually like, there is no gold standard for measuring it, right? Like basically like the best definition of health as opposed to a particular like illness, right, or disability out there is the WHO saying like health is more than just the absence of disease, right? What it is, a whole bunch of different things that we don't articulate, right? And so that's part of why it's hard to do this, right? Is not just the measures that are being used, but also because you're trying to tap into a whole bunch of concepts that are measuring different pieces, and there's no reason why one aspect of illness should be related necessarily to another, much more so why the intergenerational patterns of those should be related, right? So it just seems like there's an underlying conceptual kind of messiness, and on top of that, a difficulty in how the measures, the sort of imperfect measures that exist to try to capture that, are further kind of hamstringing attempts that you're making in order to see these systematic patterns.
Right. Well, and then there's other measures where we're really just looking at a binary, right? So the binary measures are even noisier than the self-reported health, just from, a categorical type standpoint. So I wonder how that works with the attenuation, because like if we're kind of artificially, if you will, attenuating one of the categories, I would think that the correlation between these would be also altered.
Yeah. Yeah, I think you're tackling a really high mountain, right?
Right. I don't know that there's necessarily a solution. Yeah.
Maybe Leafia has an idea.
Yeah. I saw Leafia, you had your hand up.
Oh, hi, Katie. Yeah, just with regard to that, I had a quick question, I guess, when I was hearing all this, and maybe I'm just being really slow. It's Monday, but I'm just curious, like, it seems like there are 2 different types of things that you're dealing with here. One is the fact that your different types of variables have different distributions in itself. Like you said, some health variables are binary, some are categorical, and you're trying to identify intergenerational mobility in which is different than when you have a continuous measure, which might be not solved, but it might be easier to compare. I know like BMI is such a weird measure, but that's a continuous measure in health. And I wonder if you compare that with just earnings, if you see some insight from that. But also I'm just curious how, like across these generations, there are general changes in the overall distribution. Like people may just have healthier behavior now than in their parents' generation. I was curious how you were thinking about that and how you're dealing with that in your models. When I was listening to the talk in general, though, I was a little distracted by the fact that you talked about the measure of religiosity. Like I was curious why that is there, since this, in my impression, was a paper about intergenerational mobility in health and how that compares to like economic measures. So yeah, just
Awesome.
curious.
Thank you. So first, we would love to have the BMI measure. Unfortunately, it's not available in the parents' generation. It is available for children, but we really want to keep the measure exactly like as close as possible between the two generations. So because the parents are collapsed into this binary of whether or not your parent was obese, we also then collapse the second generation into that same characteristic. Your second point, the changes in the overall trends. Yes, this is something that we've also been thinking about, right? And I think that this also touches on the life cycle bias as well. We do see more excessive drinking / alcoholism type reports in the child's generation, but keep in mind that they're being observed in their 20s and the parents are being observed in their 40s. So that's an issue that, we can solve a little bit with looking at later data. But I think your point also touches on the overall trend increase in overweight and obesity, right? So the second generation always is going to have a higher portion of individuals who do have those characteristics. Whereas a trait like smoking, we do see a decline across the generations.
Right. And also like, I feel like, sorry, just that is probably also related to like a general switch in like the distribution of occupations, for example, like how, like modern day occupations, they are correlated with higher rates of obesity, right? Which is also correlated with the economic measures. Interestingly, so just more things to think about, I guess.
Yeah, no, thanks for that. Because I wasn't really thinking about like the correlation with occupations and everything like that and how that changes health behaviors. So that's a good point. Yeah. But we really haven't done a whole lot yet with like how to think about these changing trends, more than just like acknowledging that this is kind of a challenge that we have. Thanks for pointing out the religion thing. I was debating whether or not to put that in or not. The reason that we include religion is that it's kind of still asking the question of our parents, our children like their parents in some trait. And this is a trait that we can measure in ad health. But yeah, it's very distinct from these other ones.
Katie, do you list just the intergenerational correlations themselves anywhere?
Yes. So I have descriptive statistics in, here I can reshare this screen. So I have descriptive statistics in an appendix, but I was worried.
But it's not part of the 15 minutes, right?
The 15 minutes was tough. Like I had it in there originally, and then I decided that I didn't have time to go into that. Is that something that should probably be revisited and reinserted back in?
What I've seen done not in this literature is that if you look at your slide 8 or 10, it's the first correlation matrix. Mm-hmm. Either along the diagonal or right above that diagonal, they would put in what the intergenerational measure is for each measure, so you can have all the information on one chart. Because you're kind of worried about whether, like, if religion actually had a zero correlation among the two generations, then you think, well, it's just not measuring anything. There's just not a thing to do. So the fact that it's more like 0.3 or whatever that other slide showed suggests there's, it is picking up a level of similarity that's, among the highest.
Yes, education. It absolutely is among the highest. Like really, education's the only one that has a higher persistence.
And related to that, though, how did you sort the rows in this correlation matrix?
Yeah, so the way that I have sorted it is by the list here. So I've kind of grouped resources together, and then health, and then other.
But even within these 5 health measures, why is one after the other?
No
Okay.
particular reason. I mean, I grouped alcohol and binge drinking together because they're kind of getting at the same idea.
But actually, public assistance in your correlation matrix is 3rd from the bottom, but it's
Yeah, I
grouped
did
with-
just notice that. That probably should get moved up. Yeah.
Yeah, I feel like religion, both religion and incarceration, and probably public assistance, there are also like as far as I'm aware, like big shifts across generations. So I'm just a little more confused about how to think about them. Like,
Well, you could say that I agree with you, Leafy. I mean, I think there's a generic part of what you're saying, which is just true when you have 2 generations of people raised 25 years apart. Like that's true in all so in the continuous measures, you rank them against your own
Yes.
cohort, right? So you're taking out
right.
level effects and only looking at it. So that's actually true with religion. That's one of those that gets to be ranked. And that might be also something to code the names of each, like income, earnings. You could potentially consider doing something to distinguish those that are binary versus those that are ranked.
Okay,
maybe.
within this slide, yeah.
There's a lot going on there, and you need a much better legend. I was confused about why this correlation goes to negative 0.035
Yeah,
instead of like starting around 0.
Yeah, I was also debating about that because the positive you can show a lot more granularity. I also thought about wanting to kind of balance the positive and negative side of the scale is where I was going.
But there's no blue, right? It's like a waste of colors.
Yeah, I mean, there's a little bit more when you go to the place-based side. You see more blue type coloring.
Yeah, but Katie, aren't at earnings 0.586, that goes above 0.35?
Yeah, so the issue with comparing the income and earnings, and this is another question that I've had, is whether or not I should just use one of those. In the parents' generation, we only observe income. So when we're looking at like the earnings mobility, it's really the parent's income and the child's earnings. Whereas the income mobility is the parent's income and the child's income.
Okay, I was more saying like the 0.586, it goes above the max of your correlation scale. And so that's a little confusing because it feels like it has to be like a different, more red color than your red.
Yeah, I thought about that. It's just that it's so different from the other ones that it would like artificially expand the scale,
right?
Because it is an outlier.
Yeah.
Because like at the individual level, it's 70%. I mean, so any kind of scale that we would have, that would just be a clear outlier. But so I'm wondering, does it make sense to just ditch the earnings one altogether and just do income?
When you ditch it, what you ditch are the first 2 columns. You take one of them, and the question is whether there's any information that you're losing if you just take out one of those first 2 columns, right?
Right, yeah, and if you look at like the coloring across these 2 here, I mean, it's pretty consistent. I mean, in reality, we would lose the second column here.
Right. Yeah, I mean, I think the major thing is, with 15 minutes that there's no interruption, so people aren't going to, they're just going to see this figure and not know what's going on, right? They won't be able to raise their hand and say like, there's no blue, why is 0.7 there, but your figure says it can only go up to 0.35. So there's a lot. I think the point is that from a visualization aspect, clarity for these 15-minute things.
Mhm.
And this was, I mean, the reason I'm like holding us up here is because, you know, it won't be long until we have some PAA versions of this that people are going to do, and just maybe think about what, because it's going to be the same thing. You know, you have a 12-minute talk where no one interrupts you, as to how to make, you know, these things really clear, and almost, you know, and to have two parts where that half of your presentation they can get from like not hearing a word you say, you know, and then part of what are the words you say that's going to be helpful. So I agree with this earlier comment. I mean, maybe it's okay to have religion in there. I'm a little bit on the fence that I think you need a clear justification of like why you want it there, because I think there is one, but I don't know whether it's good for the 15-minute version of the talk.
I mean, we can definitely like, yeah, because religion is very, very different than the other categories.
Yeah, I guess for me, it's just probably easier to have a clear focus, because if you put it incarceration and religion, I'm sure there are other measures in ad health that you're not including here, like fertility. Of course, these are, if you're wave 4, then people haven't really completed their fertility yet, and so that may be the reason why you're not including it. But if you're just generally interested in like what are other kinds of dimensions of mobility and how does that compare with economic mobility, I feel like it might be better to just be upfront about that instead of saying like, oh, I'm interested in health and then also other. Then the other becomes a little unclear. It seems just like whatever else you have.
Okay.
And Katie, I probably missed this. How are you dealing with gender in this? Like, are you like, yeah, like, is the child and the parent, do they have the same gender here, or?
I do have some results that that look just at males and females in the second generation. But we do use both parents, when available, characteristics for parent traits. But across sexes in the second generation, I really don't see a lot of strong differences in the patterning in terms of this picture here.
Okay, so like it doesn't matter what sex the parent is or the child is.
I don't know that I want to go that far to say it doesn't matter. But at least in our data, we're not really uncovering any kind of like big differences that would in a 15-minute presentation that would warrant like an extra slide to show this.
Yeah. I wonder, like, for things like incarceration, like, do you even observe a parent if they're incarcerated, or like Is it a local parent?
Yeah, incarceration is actually reported by the child, I think, in wave 4. And it's, was your parent ever incarcerated? So that's one of the outliers where the parent's characteristic is actually observed in later data.
Okay.
But
did anyone else have, or did Leafy have any other, I won't call them clarifications, but just, you know, after I see 15 minutes of this, is there something that would have liked to know more about during the 15 minutes, or maybe even larger, like I didn't really get what I was supposed to get after 15 minutes, those type of things, because it's just, you know, this is a practice for like exactly replicating 15 minutes of here's my main points to another audience.
I just have one more quick thing while we're on this slide. I'm just wondering, like, when I see like this is really, you know, pretty, and I was like intrigued when I saw this graph at first, but then quickly I was like, just not, maybe it has something to do with what Jason pointed out earlier, where you rank like it's not like you have economic measures first and then health and then other things. But I'm just like, I wasn't exactly sure where to look because it's just like a lot of colors on here. And like, I wonder if, like, I don't know, depending on like whether or not you had some sort of hypothesis, it might be helpful to show like the same graph, but be like, this is what it would look like if, let's say, like health and economic measures are not correlated, so something like that, so that we have an expectation of what to see if it's like one scenario versus another, and then we see your actual results and we have kind of a idea of what this is telling us. Because so far, like when I'm looking at this, I see so many things, right? I see just like basically like for example, if I'm looking at the obesity row, then I'm like trying to read, okay, obesity is like not really correlated with income and earnings and education. It's a little more correlated with overall health. It just feels really busy, and it's hard to look at this while listening to you to like explain this.
Okay.
So I wonder if there is some way to fix this so that it's a little more clear. It's also because you're like, from this graph here, I don't really see any like big message jumping out at me, right? It's just like,
yeah, so I guess that's kind of more the point, is that there's not a whole lot of correlation going on.
Yeah, so that's, if that's the point, then I feel like maybe it would be helpful to show a graph that's like, this is what it would look like if there was, if that makes sense. I don't know. But, or maybe you can just say like in your presentation and be like, this is actually telling us exactly, that's like one message, and quickly walk us through these colors and be like, look, this is looking overall pretty yellow, in the yellow range. And so this is actually telling us overall this, except one case or two cases, maybe that would help.
Okay, great. Thanks.
Yeah.
We're coming up on time, so thanks everyone for both the two presentations and for all the comments. We'll look forward to hearing from Katie what happened at the conference in a few weeks, and be back in touch next week for our next seminar. Thanks, everybody.